short, the risk factors are all women that have the early menses are less than 12 years old, or women that the menopause is not common after 52, before 52 years, and nulliparity is a condition that leads to a risk factor, and it is because exposure to these estrogens, which are the own estrogens, are the one who destroys the mammary gland. Um, Relative history, as I said before, of having first or second degree relatives that had cancer, breast cancer, that is a risk factor also, as well as hyperplasia on the endometrium. This is a history that has to be considered as a risk factor also. Um, the symptoms, the most common symptoms is palpable mass, uh, fluid through the nipple or sanguinolent fluid, or just changes in the appearance of the nipple, changes in the appearance of the skin of the mammary gland, like orange skin, retraction of the, the mammary gland also. Um, there are no preventive medicine. The prevention is just detect mass and mammary gland as soon as possible to study. And the most useful tool to detect mass is to make the manual examination of the gland every month, and this is an advice that has to be taken every woman and in their reproductive period. Um, the approach to this disease depends on the stage of the cancer. We try to detect this cancer as soon as possible before it metastasizes to the liver, to the brain, and to the bone. That is why we take these measures to detect it as soon as possible. Mammography is only one study that could be done, but it's not diagnostic. As I said before, the needle aspiration of the mass is the way we diagnose cancer, and it only has 5% false negative the diagnosis. Um, there is said that some kind of changes in diet habits, like not eating saturated fats or animal fats, rather to have vegetable diet or semi-vegetable diet, semi-baked diet, could be very helpful to prevent the development of cancer in those patients that are at risk to develop it. Um, One important point is to take into account that there is no medication to prevent the cancer to develop breast, but some good advice is to take omega-3 doses of 2,000 milligrams per day, and soy derivatives of soy are good phytoestrogens that could exchange the way that estrogens interact with these tissues. Um, well, there's not much to say, but our country in the last 5 years I went my daily consultation. I just had two patients that were diagnosed with cancer. One of them was a lady, a 15 years old lady, which I found that had changes in their skin, and I sent her to the studies, properly studies that revealed that there was um, intraductal cancer. There are another diseases that could be confused with breast cancer, and sometimes appears much more dramatic appearance, but like the Paget's disease is a disease which appears with changes at the level of the skin of the mammary gland, but is not cancer. That's why it's very important. Any change on the mammary gland or the nipple has to be considered a very important sign or symptom, and to seek medical consultation as soon as possible.